Hello everyone, it's Dr. Yazdani here. If you haven't watched my adult BLS video, please take a look. The link is in the description. The aim of pediatric basic life support is to provide effective chest compressions and rescue breaths to prevent hypoxic brain damage and help return spontaneous circulation. As in basic life support for adults, here too, you must ensure you're safe before approaching the patient. I know it's difficult, especially when you're dealing with an unresponsive little one, but you must follow the principles. Your safety comes first. The same way you're instructed to wear the oxygen mask first and help your child next in an aircraft emergency. Your next job is to find out if the child is genuinely unresponsive. If there is no response, shout for help and open the airway. If you see an obvious obstruction, you must remove it. If the child appears less than a year old, you won't need to perform the head tilt chin lift maneuver. If the child is older, tilt the head and lift the chin. Then look, listen, and feel for breathing. This should take no longer than 10 seconds. After 10 seconds, assuming there's no breathing, you get to the part where pediatric BLS is different from adults. In adults, CPR is started with chest compressions. In children, you'd start with 5 rescue breaths. The idea is to give 5 rescue breaths and see if they make a difference. If they don't, you must start the chest compressions. When delivering the 5 initial rescue breaths, obviously you should remove any visible obstruction, but don't do a blind finger sweep. Each rescue breath should take 1 second and must cause the chest to rise, visibly expand. If giving the rescue breaths is not making the chest rise, there may be an obstruction. After the 5 rescue breaths, check the pulse and feel for signs of life. Take no longer than 10 seconds. Check for a femoral or carotid pulse in a child or the inner brachial pulse in an infant. If there is no pulse or if the heart rate is below 60, start CPR. 15 compressions at a rate of 100 to 120 per minute, followed by 2 rescue breaths. You must compress the chest by 1/3 of its depth. That's like 4 centimeters in infants and roughly 5 centimeters in children. After 1 minute, call for ambulance services and restart CPR, starting with 2 rescue breaths. This again is another difference between pediatric and adult BLS. If you're a lone rescuer, current guidelines advocate phoning for help at the start of adult CPR, but after a minute of CPR in pediatric BLS, with certain exceptions. So, after a minute of delivering CPR to a child or infant, call the emergency services for help. Then continue CPR until help arrives or you get exhausted. In the upcoming video, we will go through the choking algorithm. Until then, it's goodbye and thank you for watching.